Hi, Kevin Sartin with Knob Noster Physical Therapy. We're going to try to start doing videos every week or two where we go through maybe something that we have here in the clinic to offer, or through a condition that you or someone you know might be dealing with. And we'll give you some exercises and tips that hopefully you can help the issue that you're going through on your own and get it to feeling better. So the first video that we're going to be doing today is over the rotator cuff. So the rotator cuff is a group of 4 muscles in your shoulder that have a really big job. So there are 4 tiny muscles that control rotating out, rotating in, and lifting the arm out to the side. It's a super common injury that a lot of people have. If you're between the ages of 40 and 60, 20% of those people in that age group are going to have a partial thickness tear. If you're above the age of 60, 25% are going to have a full thickness tear. And if you're above the age of 80, it's more likely that you have a tear than not. So they're super common, and hopefully the exercise that I showed you today will be a benefit to you if this sounds like something you might be going through. So the first thing we'll do are called isometric contractions, and what that is you're contracting the muscle but you're not actively moving your arm. So it's a really safe contraction and a good way for you to start to get some strength and desensitize that area a little bit to reduce your pain. So the first movement that we'll do is rotating in. So you're just going to put your arm up against maybe a door jamb or a windowsill, and you're just going to push towards the inside like you're rotating across your body, but you're not going to be going anywhere. So you're just going to pull towards the inside, and you're going to do about a 70% of max contraction. So it's not all out, you're not pushing as hard as you can. And then if you're having pain while you're doing that lighter contraction, lighten it up even more, so it's kind of underneath that pain threshold. The next one you'll do is where you're rotating out to the side, so the exact opposite motion. So you'll go to the other side, push out to the side. Again, you're not moving, you're just contracting that muscle group. And then the last one is going to be where you push out to the side this way. So if I get up against the door jamb and I push out in that direction, that'll contract that muscle group. So those 3 movements will get the rotator cuff muscle, and you want to hold that for about 45 seconds. And it's recommended to do about 5 repetitions of those at a time, a couple times a day. So those are good exercises to help with the strengthening aspect. If you have some decreased range of motion, I'll show you just a few exercises to do for that as well. So what you do is you hold with your other arm down at the bottom of a stick, maybe a cane, a broomstick, whatever you have at home, and your other hand at the top, and you're just going to go out to the front like this, and then back down. And at the top, I tell people just to hold a couple seconds. And again, if you're having pain, kind of stay right underneath that threshold. So straight out to the front, and then the other one is going to be out to the side. Same thing, kind of go up until you have some restriction and a little bit of pain. Hold there a couple seconds and back down. And then another one at your side, you're just going to rotate out to the side, hold a couple seconds, and then back in. Out to the side, hold a couple seconds, and then back in. And then the last one is holding that stick behind your back, and you're just going to pull up your backside, hold a couple seconds, and then back down. So that's a good one to start getting that range of motion back. Hopefully these exercises are a benefit to you. I want to thank you for listening. If these exercises don't quite get your problem taken care of and you think you might need some more help, please give us a call or visit our website, knobpt.com. We'd love to help you out if we can. Thanks.